Hey everyone, ready to really nail that nurse responsible for general care interview?
We're going to dive deep into how to prep with RoleCatcher's resources. Their career guides, interview
They
guides.
even have some cool AI tools, right?
Yep. We'll unpack what interviewers are looking for, give you that extra edge.
Awesome. So first things first, what exactly does a nurse responsible for general care do?
Well, it's more than just hands-on care. Think of it like you're leading an orchestra.
Okay,
You're providing physical and psychological support for sure, but you're also leading a team, making sure everyone's in sync, delivering top-notch care.
that makes sense. And this all happens in different settings too, huh? Hospitals, homes?
Rehab centers, each one's unique. RoleCatcher's Career Guide really stresses knowing your environment.
Which is a great question to ask the interviewer.
Yeah.
Like, what's a typical day look like here?
Exactly. Shows your thinking, practically. Now, ready to tackle some interview questions.
Hit me with them.
How about this classic? Describe your experience working in a general care nursing role.
Seems straightforward, but I bet there's a catch.
Always. It's about connecting your experience to their needs. Don't just list what you did. Show them how it matches what they're seeking.
So instead of, I worked at a hospital for 5 years, it's more like,
At City General, I honed my patient education skills, explaining complex post-op plans to diverse patients, making sure they were comfortable and understood. Big difference.
huge. That's
Yeah.
way more impactful. What about follow-ups? Like, tell me about a challenging patient interaction.
Oh, that one's almost guaranteed. They're gauging your conflict resolution skills, professionalism under pressure.
How do you even prep for that?
Remember the STAR method. Situation, task, action, result. Have a specific story ready. Outline the situation, your role, your actions, and quantify your results. Did you de-escalate things? Achieve a positive outcome for the patient.
Okay, the STAR method. Got it. Next question.
All right, how's this? How do you prioritize tasks when caring for multiple patients?
Ooh, that's one that requires thinking on your feet.
Definitely. They're assessing your organizational skills, adaptability.
Yeah.
Can you handle a fast-paced environment without compromising patient safety?
So it's less about specific tasks, more about your approach.
Right. Think about a time you juggled multiple urgent things. How did you prioritize? What strategies did you use to stay organized and efficient? RoleCatcher actually emphasizes delegation in this role.
Yeah, knowing when and how to delegate is key, leading a team effectively. Okay, let's keep going. What about patient safety?
Perfect segue. How do you ensure patient safety and prevent infections? This goes beyond just hand-washing steps.
Right, it's deeper than that.
They want to see you understand infection control principles. Why are protocols important? How do you apply that knowledge with every patient interaction? Think of a time you went above and beyond.
Like spotting a potential risk and being proactive.
Exactly. Or educating a family about hygiene practices. Those examples stand out.
Okay, moving on. Collaboration's got to be huge in this role.
How do you collaborate with other healthcare pros, physicians, therapists, to provide comprehensive care?
It's all about teamwork.
Think about a time you communicated a patient's change in condition effectively, or advocated for a specific therapy during a team meeting. Highlight those communication wins that led to positive outcomes for the patient.
Always bringing it back to the patient's well-being, right? What about confidentiality? That's huge in healthcare.
You bet. The question might be, how do you handle patient confidentiality and HIPAA compliance?
Just saying I know HIPAA isn't enough, huh?
Nope. Showcase a deep understanding. Have examples of protecting patient info. Did you ever correct a colleague who was accidentally sharing something? Highlight those commitment to ethics moments.
Okay, getting real now. How do you handle medical emergencies in a general care setting?
This one's like a mini emergency simulation right there in the interview.
Gotta think fast.
They're watching how you assess, prioritize, communicate under pressure. Have a story ready. What steps did you take? What was the outcome?
Having that story prepped would definitely boost my confidence. Advocacy is a big part of nursing too, right?
Absolutely. They might ask, describe a time you advocated for a patient's needs and rights.
This is where compassion comes in.
Big time. They want someone who goes the extra mile. Have a story about recognizing an unmet need. What did you do to advocate? What was the outcome? Connect those actions to your values. Why was it important to you?
It's those personal values that make your story authentic. Last question for now. How do you keep learning?
Yep. How do you stay current on new developments in nursing?
Stay sharp.
Be specific. Recent conferences, journals, online courses. What new skills did you gain that are relevant to this role? Don't just say, I attend conferences. Name a presentation that inspired you, a technique you're excited to use.
Showing that genuine enthusiasm for learning. Now, imagine a tool that can help you tailor your answers for each specific job. That's where RoleCatcher's AI comes in.
It's like a personalized interview coach. Save your favorite practice questions, get AI feedback on your written responses.
You can even practice with video responses,
Yeah.
right?
Yep.
And get AI analysis.
Exactly. We'll dive deeper into those AI features later. For now, remember, these questions are just the start.
RoleCatcher has full career and interview guides for even more in-depth prep.
Let's take a quick pause. When we come back, more career insights from RoleCatcher and how their AI takes your prep to the next level.
We're back. Before we get to that AI stuff, let's sprinkle in some career insights from RoleCatcher's guide.
Right, because it's not just about acing the interview.
It's about understanding the whole landscape of this nursing role, where it fits in healthcare. And, the guide really highlights technology. It's becoming so important.
Like telemedicine and those wearable health devices.
Exactly. They're changing how care is delivered, even if the interviewer doesn't directly ask. Mentioning them shows you're forward-thinking, adaptable.
Makes it sound impressive. Like, I've been keeping up with remote patient monitoring, excited to see how that can improve care. See, now you're not just focused on daily tasks, you're thinking about the future of healthcare. And speaking of the future, the guide also mentions the rising demand for nurses responsible for general care, especially ones with strong leadership.
Makes sense. Aging population, more home-based care. Seems like these nurses will be in high demand.
Exactly. Which brings us to another point from the guide. Self-care. Avoiding burnout.
Oh, right. This role can be tough, both physically and emotionally.
Very rewarding, but demanding. So even if it's not a direct question, showing you're aware of those challenges, that you have strategies for staying healthy, that's important.
Shows maturity, self-awareness, good leadership qualities. Okay, ready to talk about RoleCatcher's AI. I'm curious how that can help.
All right, let's dive in. It's pretty cool. It goes way beyond basic interview tips.
Yeah, I've seen a bit about it. It's not just about memorizing answers.
Nope. It helps you understand the why behind the questions, so you can craft authentic responses tailored to the specific job you're applying for.
That's where the AI comes in, right? Analyzing the job description, suggesting skills to highlight.
Exactly. It even finds those key words that make your application stand out to the hiring manager. It's like a secret weapon.
I love that it gives feedback, too, on your practice responses, both written and video, like having a personal coach.
It is. And it can pinpoint weaknesses in your answers. Maybe you're not quantifying your results enough or using too much jargon.
That's so helpful, like a second set of eyes, but with AI power.
Yeah.
Does it get better the more you use it?
Yep. It's constantly learning, understanding your strengths, weaknesses, giving more personalized feedback over time.
Wow, that's amazing. So to recap, we've talked about the nurse responsible for general care role, the STAR method for answering questions, all those career insights from RoleCatcher.
And we've touched on how RoleCatcher's AI can really help you prepare. Tailoring answers, getting feedback, boosting your confidence.
But in the end, it's about being yourself, letting your passion for nursing shine through.
Because interviewers are looking for more than just skills. They want someone who fits their team, who genuinely cares about patients, someone who wants to make a difference.
Here's something to think about. What's a time in your career where you went above and beyond for a patient? Maybe you comforted a child, helped a family through a tough situation.
Yeah.
Or just listened when someone needed it.
Those stories are what make you stand out. They show your heart, your dedication, and that's something AI can't replicate.
All right, everyone listening, go rock those interviews. We're rooting for you.
And don't forget to check out RoleCatcher's full career and interview guides for even more help. You got this.
It's pretty amazing. We've gone from specific interview questions to the bigger picture of what this nursing role really asks IS.
It's a whole blend of things, right? Clinical skills, but also leadership, compassion, and always learning new things.
And RoleCatcher gives you the tools to show all of that in the interview, not just giving the right answer,
Yeah.
but presenting yourself as a whole person.
Someone who's passionate and ready to make a real difference. Authenticity. That's what connects with interviewers.
Yeah, they want to see if you're a good fit for their team, if you share their values about patient care.
Right.
So everyone listening, as you prep for your interview, just take a deep breath.
Yeah.
Be yourself. Let that passion shine through.
We know you're going to make a fantastic impression. And hey, RoleCatcher's there to help every step of the way. So go out there and rock that interview.
We can't wait to hear about your success stories. And that's a wrap for our deep dive into prepping for your nurse responsible for general care interview.
Make sure to check out RoleCatcher's career and interview guides for even more tips and insights. Good luck.